Dal congresso europeo di oncologia medica di Madrid è arrivata una novità importante per il trattamento di un tumore cutaneo diverso dal melanoma, cioè il carcinoma squamocellulare o carcinoma a cellule squamose resecabile. Al meeting, infatti, è stato presentato uno studio nel quale questo farmaco, che è un inibitore di PD1 già approvato attualmente per i pazienti con malattia avanzata, è stato utilizzato invece come trattamento neoadiuvante, prima quindi della chirurgia, con risultati molto promettenti. Noi ce li facciamo raccontare dall'autore che ha presentato i dati appunto al congresso ESMO, il professor Neil Gross dell'MD Anderson Cancer Center di Houston. Dr. Gross, what's the key message of the study you presented at ESMO 2023 and why is it important?
Well, thank you for having me. The key message from this trial is that the survival outcomes for patients with stage 2 to 4 cutaneous squamous cell carcinoma treated with neoadjuvant Cemiplimab is favorable. There was a lingering question from the initial presentation where we demonstrated significant pathologic responses. Well, how do these patients do in terms of survival? And here we show that they do excellent.
Could you explain the design of the study?
Yes, so in this trial, it was a non-randomized, multi-center phase 2 trial in the US, Germany, and Australia that included 79 patients with stage 2 to 4 resectable cutaneous squamous cell carcinoma. And in this trial, all patients received up to 4 doses of neoadjuvant Cemiplimab prior to curative intent surgery. After surgery, in the second part of the study, the adjuvant portion, patients were eligible to receive either adjuvant Cemiplimab or adjuvant radiation or observation at the discretion of the investigators.
And which were the endpoints of the study?
So the primary endpoint of the study, which we presented last year, was the pathologic complete response rate to neoadjuvant Cemiplimab. And we presented and published in the New England Journal a very high pathologic response rate. So 51% of patients had a complete pathologic response. Another 13% had a major pathologic response. Here, we present the survival outcomes for the overall cohort of patients as well as for patients according to pathologic responses. And these data were published concurrently in Lancet Oncology.
And which are the main efficacy results that you presented at ESMO 2023?
So we demonstrated exceptional survival outcomes for patients treated with neoadjuvant Cemiplimab. For the cohort overall, there was an 89% 12-month estimated event-free survival. And in fact, for patients who had any pathologic response, the event-free survival was favorable compared to patients who had either no surgery or were non-responders. For example, patients who had a complete pathologic response had a 95% event-free survival with a median follow-up of 18.7 months.
And what about the safety of the neoadjuvant treatment with Cemiplimab in this patient population?
Patients treated with neoadjuvant Cemiplimab tolerated the therapy quite well. We published previously the experience in the neoadjuvant setting. There was one death that was potentially related to study treatment. This was in a 93-year-old patient with significant baseline medical comorbidities. She experienced exacerbation of congestive heart failure that was thought to be possibly related to study drug. There were no other deaths that were attributed or possibly attributed to study drug. Here we report the safety of the adjuvant portion of the trial as well. So in the adjuvant portion, patients were eligible to receive Cemiplimab for up to 16 doses or 48 weeks of treatment. We reported 2 grade 3 SAEs, including worsening cardiomyopathy and hypophysitis, but there were no deaths related to study drug, and overall, adjuvant treatment was well tolerated.
Professor Gross, finally, which could be the implications of this study in the upcoming future?
The results of this study are very encouraging, and I think there's a lot of excitement around how this could change the future standard of care for patients with resectable cutaneous squamous cell carcinoma. Already, we know that neoadjuvant treatment can be useful in patients who are at risk of significant functional loss with surgery. For example, if a patient was having to require an orbital exenteration, they may benefit from a neoadjuvant approach. But most importantly, these data are encouraging us to pursue a randomized phase 3 trial to test this approach against the standard of care. And this trial is expected to launch in 2024.